Hi everyone, welcome to this BTEC National Health and Social Care live stream. We're doing an exam warm-up for your Unit 2 exam tomorrow. I'm Liz and I'm joined by Laura. Hi Laura.
Hello, good evening everyone. Thank you for joining.
Brilliant to see lots of people in the chat talking about your revision. Let's get straight into it because we've got quite a lot to get through today. So let's see what we're going to do first of all. So I'm just going to talk you through the sections of the exam paper. I'm sure you all know this, but let's just go over it just to calm our nerves and start us off gently. So in every section you'll have an identify question worth 2 marks, and to answer this you need to give 2 unique bullet pointed answers. You will then have a describe question worth 4 marks, and again you need to give 2 unique answers. This time you'll be writing 1 or 2 sentences. You'll then have an explain question for 6 marks, and you'll need to write in paragraphs to explain how, what, when or why something is happening or the importance of something. And then you'll finish each section with a discuss question for 8 marks, where you have paragraphs in your answer to discuss a variety of linked points. So in each section, when you do your identify and describe answers, you need to make sure that your answers are relevant to services and service users generally, and then when possible, the case study specifically. And then for explain and discuss, your answers must be very closely applied to the specifics of the case study. So remember, you get a case study at the beginning of each section. Try and link as much of your answers as possible to the case study, but definitely your explain and your discuss questions. Okay, so let's get on with some revision. We are going to go through with sections like you do in your exam paper. Nothing too scary, nothing too challenging. So we're going to start with section A, as your exam does, which is always on ill health, either physical or mental. Over to you, Laura, for this first activity.
Thank you, Liz. Okay, guys, so I'm going to ask you to give me 4 charities that support individuals with ill health, okay? And that can be physical or mental. So Liz is going to set a timer. You're going to hear some lovely summery music, and we're going to try and come up with as many as we can. So if you could type them in the chat for me, please have a go. It doesn't matter if you get them wrong today. So any charities you've heard of, guys.
Okay, we've got some coming through now.
Lovely. Try and think about maybe some mental health ones.
Okay, we've got some really good answers there, Laura. I'll read out a few that I can see. We've got Marie Curie, which is cancer care. We've got Age UK, which is for later adulthood. British Heart Foundation for heart disease. Alzheimer's Society, which is for dementia and specifically Alzheimer's. We've got Mind, we've got Young Mind, which are mental health charities. Samaritans, which is a mental health charity. They're coming through so quickly. I saw another really good one, and it's zoomed past me, but it was a good one. Let me just see if I can see it. MenCap for learning disabilities, really good one.
Fantastic. Amazing, guys. Well done. Just remember that sometimes the word charities might not be stated in the question. They might refer to it as voluntary services, okay? Sometimes they're a little bit mean. Let's look what we got. Okay. Mind, Samaritans, Diabetes UK. I don't think we heard that one in the chat, did we, Liz? Unless we missed it.
Don't think so.
And the Heart Foundation. But we had some fantastic ones from you guys. I don't think we've got anything to worry about with that one.
Excellent. Okay. Let's have a look at our next activity. Okay, for this one, you're going to have 60 seconds with a musical timer again, and it's a matching activity, and you're going to match up to make 5 great answers to the question, describe the responsibilities of nurses when caring for patients with physical ill health. So if I show you the next screen, so your A, B, C, D and E are responsibilities, and then the 1, 2, 3, 4, 5 is the completion of your description. Okay, so you need to match the responsibility with the description of it, so why it's done in this case. So you can just type in the chat A and then the number that links to that, B and then the number that links to it. So a bit more reading this time, so we're going to give you 60 seconds and some music. Here we go. Wow, Lewis was very quick. Check your answers, Lewis. Chloe's having a good go.
How are we doing, Liz?
Loads of answers. Okay, they're coming through so quickly. I'm struggling to check them as they do, but I am going to just select someone and then see if they've got it right. So I have just randomly selected Sir Ruby, who says A, carrying out observations, example of blood pressure links to 3. That's not correct. I think B, regularly washing hands with soap and water links to 3 to avoid transmitting infectious diseases between patients. Okay, let me see if I can select someone else to have a check. Let's go with Erica Core. So A, carrying out observations, for example, of blood pressure has been linked there to 4 to monitor physical condition of the patient. Excellent. Regular washing their hands with soap and water, Erica is linked to 3 to avoid transmitting infectious diseases. Brilliant. C, clearly communicating patient needs to other members of staff, Erica has linked to 5 to ensure that care is person-centred and respectful. Yes, you could argue that, but I think that's actually number 2, to ensure effective multidisciplinary working. Where have I got to? I'm confused now. D, completing all documentation accurately. Erica has linked to 1, yep, to make sure that medical records comply with data protection law. Excellent. And then E, asking patients about their needs and preferences, links to 5, to ensure care is person-centred and respectful. So just to be clear, I will reveal the answers now, because this one can get a bit confusing. So you can see how these are really good answers for describe questions, because they clearly give a role or a responsibility and then describe how it's done or why it's done or the importance of it. Okay, so make sure your descriptions are full and complete and that you give 2 unique answers. Okay, brilliant. Let me just go back to that comment screen so I can see everyone's comments. Okay, Laura, over to you for this next one now.
Okie dokie. So we're going to do an activity that we like to call such as seasoning. So we're going to add the such as on, okay? So we're going to finish the statement by saying such as. So professional regulation is important for many reasons, such as. Now, this is a topic that generally students find quite tricky, okay? So let's all have a go at this one. So why is professional regulation important for many reasons? Can you give me one reason?
Okay, we've got Char says to ensure high standards of care. Brilliant.
Ooh.
Toby, ensuring the safety of service users. Excellent. That's my number 1 go-to always with regulation, is safety. Chloe says keeping service users safe. Yes. They're coming in really quick now. Liv, to prevent abuse and neglect. Excellent, Liv. Tiber, to prevent service providers harming service users. Yeah, great answer, Tiber. Daisy, ensures service users' care is to high standard, ensuring their health, privacy and safety. Brilliant. Alina said holding professionals accountable. Really, really good. I like that one. What else have we got? Hannah, protection of service users. Liber, ensure staff are meeting standards. Char, to prevent discriminative practice. Excellent answers. We've got some about national occupational standards, national standards, codes of practice, safety from abuse, harm and neglect, to ensure people have the right skills. Excellent answers. I don't think these students are going to struggle with regulation questions at all, Laura.
Prove me completely wrong, guys, and I love it.
Okay, let's reveal our first answer.
Okay, so we could have finished that sentence by saying such as keeping the public safe, which many of you identified, but we're going to build on that by saying by ensuring that doctors, nurses and allied health professionals are fully trained. So we've not just said that it's important because it keeps them safe, we've then built on that answer as well with a little bit more detail.
Yeah, brilliant.
Fantastic.
So it's about putting a lot of the answers that you guys gave together to build up a nice full answer. So I think we've got another one.
Okay. Alternatively, we could have said such as providing a mechanism for investigating serious complaints and the fitness to practice of professionals.
Okay, so I just want to tell you at the a good point at the moment to tell you, I can't talk, that I will upload this PowerPoint to the Tutor to You website after the live stream, and I'll pop the link in the comments for this live stream. So if you want to watch a replay later on, you can pause the video, but also you can download the PowerPoint if you want to have a look at it. But don't stay up late doing any revision tonight, guys, and we'll remind you of that at the end. Okay, so remember we said that you're going to get a scenario at the beginning of each section, 4 sections in your exam paper. Here's an example scenario, and it's still ill health. So Draco recently had a heart attack and is recovering from coronary artery bypass graft surgery. He's being cared for by a team of doctors and nurses in the local general hospital. The question is, explain the importance of inspecting hospitals like the one that Draco is being cared for in. So think about that scenario. Someone that's had a heart attack, they've had surgery, they're being cared for by doctors and nurses in a general hospital, and we're looking at the importance of inspections. So what we're actually going to do is amend the gap activity for this one on the importance of inspections. So I can see you guys giving me brilliant answers already, but what I actually want you to do is have a look at the screen and work out what is behind the blanks. So Laura, I might get you to read through this one for me.
It's absolutely fine. Okay, guys, let's see if we can do this one together. So, inspection is important because it checks the of care provided. For example, checking that infection prevention and control policies and procedures are robust. This ensures that patients like Draco do not develop what after surgery.
Sweet.
Another important reason for inspection is to check that what are happy with working practices, the level of supervision they receive, and that their concerns are listened to. For example, checking that procedures are clear and available for staff to follow when they wish to escalate a safeguarding concern. Finally, inspectors can listen to feedback from who to check how happy they are with the quality of the care they are given and whether they feel safe, dignified, and respected.
Okay, Laura. So I think a lot of people are saying quality for the first one. So inspection is important because it checks the quality of care, which sounds quite good to me. And then for the second sentence, this ensures that patients like Draco do not develop infection, people have said, or infections. I think someone might have said complications. Then we've got, for example, checking that something procedures. So we've got infection procedures and policies and procedures and risks and procedures, but that's not the exact one that I'm thinking of. So think about the rest of the sentence. For example, checking that blank procedures are clear and available for staff to follow when they wish to escalate a safeguarding concern. So what policy specifically or procedure could that one be? And then they're saying for that final one, inspectors can listen to feedback from patients. Some people have said service users, some people have said individuals. I would accept any of those. So just scrolling to see if anyone's got that specific procedure that I'm thinking of. Okay, well done to Toby for getting whistleblowing, and Daisy and Liv and Jessica and HP. Lots of people now. So let's reveal then. So we said safety of care, but you guys said quality of care. I think those are equally valid. Infections after surgery, yep, you could have complications. Check that staff are happy with working practices. Oh, I think I missed that one out, sorry. Checking that whistleblowing procedures are clear and available, and then listening to feedback from patients. So well done, guys. If you wrote that as an example, as your answer for an explain question, you'd get some really good marks. You can see they've made 3 good points. They link well to one another. They follow on. They're appropriate to hospitals. But we would expect to have as much application to the scenario as you can manage to put in there. Okay. Anything you want to say about that, Laura, before we move on?
Again, like you said, Liz, I think when there's a case study available, it's there for a reason, guys. So make sure we're linking back to the specifics of the case study.
Yep. Okie doke. So let's think now about section B, which is on learning disability. Okay, over to you, Laura.
Okay, guys, so we're familiar with this task now. So I'm going to ask you this time to give me 4 policies that a day centre for service users with a learning disability must have. So 4 types of policies. Off you go.
Some really good answers coming through. I'm trying to select some good ones as they come through. Okay, Laura, some of the ones that I favorited are Esha says safeguarding, Yara says equality and diversity, Alina says health and safety, Char says anti-discrimination. Let's see what else we've got. Whistleblowing from Khadija. Well done, Khadija. Data protection, GDPR, safe disposal of medication. Shall we have a look at ours?
Yep. Okay, we have gone for safeguarding policy, infection control policy, workplace health and safety policy, and equality, diversity, and inclusion policy. 4 really good ones. There are some common mistakes that we see on questions like this, guys, that I've seen pop up in the answers are maybe stating a legislation. So a couple of people put GDPR, so not getting that mixed up. Remember, that's a legislation. And someone else put risk assessment. I can see where you're going with that. Risk assessments would be included in the policies, wouldn't they? But they're not a standalone policy on their own.
Mm-hmm. I think these 4 answers are really good ones to kind of seal in your mind now, because they can apply to absolutely any setting or any service. So it doesn't matter what setting or service it is, they would all have to have those 4 policies in place. So if you get a question about policies, those 4 are safe bets. I can see that Sani is asking what's a lone worker, and then Toby has given a really good answer. When someone works alone, so they have to tell someone their whereabouts to ensure their safety. Yeah, brilliant, Toby. So if you have people that are lone workers in your organisation, you have to have a lone worker policy which states how you'll protect them, how you will monitor where they are, how you will keep them safe. R is saying, what is GDPR? No one has typed an answer yet, but it means General Data Protection Regulations, and it's part of the Data Protection Act 2018. So it's all about what we can and can't do with people's personal information, and we might have some questions on it later on. Okay, let's move on. So we are going to do another 60-second challenge. So you know how to do these now. I'm going to give you 60 seconds to make 5 good describe answers. This time the question is, describe the rights that service users with learning disabilities have when using a day centre. So we're talking about rights that service users have, specifically those with learning disabilities. So remember, you've got your rights on the left side, so your A, B, C, D, E, and then you've got examples of them on the right hand side, which is 1, 2, 3, 4, 5, and you need to match them up correctly. So giving examples is another really good way to get that second mark in a describe question. So I'll give you the music and you can just give us A and then the number that it matches to and so on, and I'll try and check them as they come through. Okay, I think I've got all the correct answers favourited. So let's see, Laura. This is quite challenging for me. Okay, so first of all, Melissa Carlin says A2. So the right to be free from discrimination links to, for example, not to be treated unfavourably due to their learning disability. Excellent, well done, Melissa, and everyone else that said that. Then we have IO saying B5, so the right to make their own decisions, for example, about what activities they do or do not want to take part in. Excellent, IO, well done. Then Esther saying C3, so the right to be listened to and to have freedom of expression, for example, to express their sexuality. Excellent, Esther, and others that got that one right. Simran says E4, so the right to advocacy, for example, if the service user has communication challenges, someone may need to help them have their say. Excellent. And then N says D1, the right to access all activities, for example, making reasonable adjustments to allow everyone to participate, for example, using Makaton. Brilliant, excellent answers. So remember, if you're asked to describe something, giving an example can really help you to get that second mark. So your first mark here is like the right, so knowing a right that applies, and then giving an example to show you really know what you're talking about. Well done, everyone. I can see loads of really great answers there. Fantastic. Okay. Would you like to do this one, please, Laura?
Absolutely. Okay, so section B, learning disability then. We've got a little case study that I'm going to read you out. Was you thinking of Harry Potter at the time, Liz?
I obviously was, yeah.
Hermione is a support worker at a day centre for service users with learning disabilities. She is taking a small group to the outdoor swimming pool. So the question for this asks you to discuss how risk assessment will help Hermione keep the service users safe on their trip. Okay?
So remember, discuss questions. They are the difficult ones at the end, aren't they? You need to provide lots of interlinked points for your discussion. So I can see lots of people giving some ideas. What we're going to do this time is a tug of war. So we're going to present to you two paragraphs, paragraph A and paragraph B. Laura's going to be student A. I'm going to be student B. Laura will read out her paragraph, I'll read out my paragraph, and then you guys can decide which is the best way to start answering a 6-mark discuss question on this topic, okay? So just so we're all remembering, the question is on the screen. Discuss how risk assessment will help Hermione keep the service users safe on their trip. So student A, Laura, please read out your paragraph.
Thank you. So risk assessment will enable Hermione to take a systematic approach to identifying possible risks involved in the trip. This will mean that she can take as many preventative measures as possible to stop risk resulting in harm. It also means she will be mindful of harms that could arise whilst on the trip and be prepared for them. The first step she should take is, because remember this is just the beginning of my answer.
Okay, so I'm going to start my answer by saying risk assessment is needed because it's a way to keep her service users safe. Hermione should follow the policy on workplace health and safety to do the risk assessment. This way everyone will stay safe and she will have fulfilled her obligations. So tell us which of us is best, A or B, and then also tell us why. So either the good things about A or the kind of the flaws in B, okay?
I just saw a good answer from Melissa, Liz,
Okay,
and then
let me
it
see if I
disappeared
can.
because that
I'll
many.
see if I can find it. Oh yeah, I've got it. Okay, I'll favourite that one. Yep. I'm going to favourite Charlie's answer as well. So I can see a few people saying A because it's more detailed. I want to know a bit more about that. Like, so what about the detail? Okay. So let's start looking at some of these that I favorited. So Melissa said A, it's more detailed. It doesn't repeat the question where you won't get any points. Absolutely. So in my paragraph in B, I did repeat the question and I talked about risk assessment quite a lot without saying really anything about it. Brilliant. Charlie says A is more detailed and then says in B, we haven't remembered, or I didn't remember that it was a trip out of the workplace. So Melissa's saying A also gives ways as to how you can do that. That's why it's better. Daisy says refers to the case study more, adds more detail on the steps that you do in a risk assessment. Yep.
Oh, we've got a nice word there from Char.
Yeah.
Or Char. Contextual. A is more contextual.
Very much so, yeah. Esha says A is using key terminology. N says A because it explains how it will prevent those risks from harming people. Yep. Shima says explains what a risk assessment is. Saw another couple up here. Alina says explains what a risk assessment is, how it would prevent harm, shows understanding of the purpose, leads naturally in discussion on the steps. Yeah, brilliant, Alina, well done. This is all pretty much what we have said. Let's have a look. So we do agree that Laura's paragraph was better. So it sets the scene by outlining the overarching purpose of risk assessment, which is what I think it was Alina, wasn't it? What Alina said. And then it suggests that this person is going to go on to describe each step methodically. So it's a really good start to a discuss question. Whereas paragraph B, it's not wrong, but it does repeat the wording of the question, as someone pointed out. I think Toby said that as well. It refers twice to keeping individuals safe, which is what kind of it says in the question, but hasn't said how this will be done and what a risk assessment is. So I did see a few questions. So Sani says, do you have to do an introduction or can you just say your points? So you don't need an introduction as such. However, student A has shown that they know the purpose of a risk assessment, so the overarching purpose and how it reduces harm. So if that student then was to go on and run out of time, they would still get some good marks because they've shown really good knowledge and understanding. So no, you don't need an introduction, but showing your overall knowledge is potentially a good thing. I can't think of the other question that we had. It was about conclusions, I think. So unlike on the Unit 1 paper, you don't need to have any conclusions on your Unit 2 paper. Okay, so your explain questions for 6 marks are a series of explanations that link together and link to the context. And then your discuss questions are a series of points that discuss as many perspectives of the topic in hand as you can, but no, you don't need a conclusion. Okay. Someone has said, how many marks would the B answer get? Well, this is only the start of an answer, so I would expect the student to write more than this. I don't know, it might get up 1 mark if they're lucky, if they wrote that much in the exam, but obviously you need to write more. And then so Ruby's saying, do you get more marks for an evaluation? Is it good to include to show your understanding? It's not an evaluation question, it is a discuss question. So you need to discuss alternative perspectives and interlinked points. So you don't need to evaluate as such, so you don't need to weigh up the value of something unless the question is discuss the importance of, and then it kind of is like an evaluation question. The main thing is, what is it asking you to do? Make sure you answer that in your series of interlinked points that also link to the case study. Escher is asking, how many paragraphs should I do for an 8 marker? That's a tricky one, isn't it, Laura? Depends.
It is.
Depends on so many factors.
Yeah, it does, guys. And we typically say for an 8-mark question, you want to be including at least 4 key points and then building on and expanding those, relating them back to the case study. But that doesn't mean that you couldn't get good marks if you did less or more. But on average, that gives you enough space to get into the detail that's required while showing enough breadth of knowledge at the same time.
Jessica's asking, do you need paragraphs or can you just write a long paragraph with the points? I think the important thing there, Jessica, is that you could write a long paragraph without any spaces, but make sure that you're making a point, you're explaining your point, you're evidencing it, and you're linking it back to the question and the case study. So peel paragraphs. So it doesn't have to be like nice, neat paragraph, space, paragraph, but make sure you are making a point, explaining it, evidencing it, and linking it back. Okay.
Yeah, don't leave lines in between your paragraphs. There's waste.
Yeah.
Space.
Absolutely. Okay, so let's move on, guys. Section C will always be about physical or sensory disability. Okay. So we're going to do some word smashes. These are my favourite. So to do a word smash, you have to combine the picture clue with the text clue to create an answer that smashes them both together. And this one is about overcoming barriers. So if I just talk you through it, we've got a screen on the left-hand side, and then it says person or device that reads, which is reader. So your answer would be screen reader. So a screen reader is a way of overcoming a barrier if you are visually impaired. So it will read out what's on the screen in front of you. So hopefully everyone gets how we do these. Let's go for the first live one. So what do we think this is? And it's about overcoming barriers. Come on, I'm sure some of you have got it.
What could it be, guys? Think about the topic, overcoming barriers.
Yara, well done. And Charlie, yeah, brilliant. So hearing loop.
Well done.
So
Getting the hang.
hearing loops can be installed in like public places, cinemas, theatres, and you tune, if you have a hearing aid, you tune your hearing aid to the loop and then it transmits the sound directly into your hearing aid. Care homes and residential homes also have them. Okay, next one. What do we think this one is? Any guesses?
I can't see any yet, Liz. Yours might be a bit quicker than mine now.
People are saying something training. Liv says CPD. Well done. Chloe says staff training. Yep. So staff training can be a really good way to overcome barriers. So if you train your staff in deaf awareness, then they know better how to communicate with people with hearing impairments, for example. If you train people in how to work with people with autism, then they can help overcome sensory barriers as well. Okay, let's have another one. Nice easy one now. Come on, guys. Quick. Alina says we are cooking. Yeah, we are. We're on fire. Well done, everyone. They're all coming through now. Wheelchair ramp. Brilliant.
Well done.
Fabulous. So barriers is quite a common topic on the Unit 2 exam. Obviously, we don't know if it's going to come up tomorrow, but it's worth revising. How about this one? So we've got sign language translator, interpreter, sign interpreter. That's the best one so far. Sign language interpreter. I was actually thinking of something specific. So Saskia said BSL. So I'm told that this sign on the screen is the sign for BSL, okay, which means British Sign Language. So BSL interpreter. So if someone uses British Sign Language as their first language, we might try and get a BSL interpreter to interpret between that person's sign language and the carer looking after them. Brilliant. Another one here. What's this one?
Tough one, this one, I think, Liz.
It kind of is, but I could have had just the middle picture maybe and it would have still worked. Ruby says leaflet. Nearly. Toby says easy wording. Nearly, Toby. So what's contained in leaflets and flyers? Okay, so Esther's saying information. Charlie's saying easy read something. So what is it? Put them all together. Easy read information. Brilliant, Charlie, well done. Easy read information. So individuals with learning disabilities appreciate if we put our information, our leaflets, our flyers, our posters into easy read formats. So easy read information, lots of pictures, less complex words, less complex sentence structures. Okay, so the final section, section D, is on age-related needs, and it will either focus on early years or later adulthood. Okay, so I will hand over to Laura for the first activity.
Okay, so the statements that I'm going to read out, we are going to decide, is it this or that? So you've got two options at the bottom. So nurseries, playgroups, childminders, preschool, reception class, children's services. Would that fit better with the early years category or the later adulthood category?
Everyone is saying early years, Laura.
Fantastic, well done. Okay, you get the gist now. Next one. So may require equipment or home adaptations to maintain independent living. Oh, they're quicker than I've even read it out.
Yeah, later adulthood, brilliant. Number 3 now.
Pediatric nurses and doctors, midwives, health visitors. Which age group?
Yep, lots of early years coming through.
Fabulous.
Okie doke. Number 4.
Okay. Safeguarding concerns include financial abuse or exploitation, physical abuse as may be dependent on caregivers. Which age group would that be associated with?
Slightly harder, but
Hmm.
I can see lots of correct answers coming through.
Yeah. The financial abuse one would be the
Yep.
indicator for me. Good. Well done, guys. Social care, healthcare, and education providers must work together for this age group to share information to keep this group safe.
Yep,
Again, the
brilliant.
indicator might be education providers there.
Yep. Fabulous. Well done, guys. Okay, so that takes us to the end. Well done. You've all done really well. Our final thoughts, Laura. What are our recommendations for this evening?
Absolutely. Let's keep it simple. So, plenty of sleep tonight, guys. Please don't stay up, okay? Your brain needs rest to be able to work properly tomorrow. Do what you can to unwind. Potentially, I would recommend reading a book if you're a reader. If you're going to watch some TV, maybe nothing too dramatic. Maybe one of your comfort series. I have a comfort series and it's Friends. It's something I can just switch off to. Make sure you've had a really good meal, okay? So think about staying hydrated, not really fueling up on loads of sugar or caffeine. That's going to impact your sleep. If your teacher is kindly enough running a prep session for you tomorrow, make sure you go, okay? It can help. And you've got this, guys. Adopt a positive mindset, okay? You believe you can do it. You've got all the information now. Read the question twice would be my biggest tip, and make full use of the time, okay? If you have finished early, go back and reread the questions. There where the silly marks are lost. They can be the difference between 2 grades. Oh, I'm seeing that someone had steak and chips for tea. That's definitely brain food.
Wow, that sounds amazing.
Making me hungry.
Okay, so good luck, everyone. You're going to be amazing. Just stay calm, take a deep breath. You'll be great. Thank you so much for joining us. Thank you as well to Laura. Let us know how you go, guys, and take care of yourselves. Thanks so much. Bye.
Thank you. Bye.